Over the last 24 hours, we recorded 44 new cases, and we are now tracking 465 cases across the country. The highest caseload we have right now is in Regions 4, followed by Regions 3, and then Regions 5. So we have seen an increase in cases in Region 5 over the last Regions 4 couple of days. And again, 3, once people are exposed to persons who 5 are not, who are positive, but if they're not wearing their mask and so forth, we are going to see an increase in cases. 3, and then last week there was a big horse racing event in Region 5. So we are probably now seeing an increase in cases in that region. We're going to see an increase in cases. First of all, there is national guidelines as it pertains to people who have tested positive. So if you've tested positive, you have to isolate so as not to infect others, especially with this particular subvariant of the Omicron, who will be tested positive. It is highly transmissible. So if you are next to someone tested positive, who is infected with BA5 and you are not wearing your mask or taking the relevant precautions, then you would get infected. So it is advisable that persons who have tested positive isolate from others so as to prevent the spread. If people are ignoring that and they go to work, they would obviously be spreading the virus in the workplace. Now, we know that for most people, they might have mild symptoms. They go to work. Very often, it looks more like a flu in terms of the presentation of symptoms. We know that for most people would have some fever, mild congested nose, or maybe a runny nose, some sore throat and things like that. But there are persons who, they have other underlying illnesses. Maybe they have high blood pressure, they have diabetes, kidney problems, and so forth. These persons, if they're not up to date with their vaccination, unfortunately can have a more severe form of COVID, which can result in hospitalization and even death. So it is not the same for everyone. They're not up to, and therefore, if we are going to protect each other, we really need to, which can result in these precautions. So one is to make sure that if you test positive, if they're not a responsible thing to do, or is to stay home. If we are going to take these, which can result in hospital precautions. So one is to make. So right now, the vaccines that we're using for persons 12 years and older, take these, which can result in vaccine. And we have a pediatric form of the vaccine that is for children between 5 and 11. The pediatric version is 1/3 of the adult dose. But for children 12 and above, let's say 12 to 17, they receive the adult formulation. And that was what is recommended by Pfizer, the US FDA, all the regulatory bodies. But for we have adequate amounts of Pfizer vaccines, and whatever you get as your first dose, it is the same vaccine that is used as the second dose. So we have enough vaccines, and that's so anyone requiring a first dose, a second dose vaccine, that we have enough at the various vaccination sites. It's not a different vaccine. I think maybe people are under the misconception that it's two different vaccination sites. It's not two different vaccines. So when you get your first dose, you come back 28 days after, and they give you the same vaccine, but it's just the interval of time. Because they know that once you have first dose, second dose, that your immunity goes up. If you have one dose, that's considered as partial vaccination, and you wouldn't get that. But once you have